Thank you, folks. I do not deserve the applause. Let's give another round for Tammy. That is what advocacy is about. That's what I'm going to talk about, but she lives it day in and day out. That's what we all need to be doing. We spend a lot of time looking at this room and standing up here today, and I appreciate the invite to come over here and talk about advocacy and what we do at our FQHCs, but Tammy, again, is living it every day. We are doing a lot of preaching to the choir here. How many folks have all heard that term, right? We're doing a lot of preaching. How much preaching are we doing to the non-believers about dental care, about health care? That's what advocacy is about. That's what Tammy is doing, is talking about to the non-believers about what is going on. So, way to steal my thunder, Tammy. So, as my colleague Caitlin Wilkinson was up here on the earlier panel, I work for the Pennsylvania Association of Community Health Centers as well. Again, you don't need to hear about all the stuff we do. We do have 475 locations across the state that are doing a lot of amazing work. More than 90% of them are providing dental care. A lot of them have dental-only locations. So it is somewhere obviously growing based on the need. We're doing a large portion of the Medicaid work. But as she mentioned, FQHCs, we care for everyone in the community. By law, we must care for you no matter your ability to pay. We have sliding fee scales for dental care, physical health care, behavioral health care, vision services. We employ more community health workers than any other healthcare provider across the state because they're vital in connecting our patients to the folks that are receiving the care, to the other services in the community like food banks. We've been hearing a lot about them over the last month. That's part of what our advocacy is. It's not just dental care, and just probably isn't the word. It's realizing that healthcare is all of those pieces together. It's food insecurity, it's housing, it's being able to pay your bills and having transportation, all those other things that go along with our traditional thoughts of dental care and others. Patient statistics. Caitlin talked about the services we provide. We have, as you saw on the previous slide, about 1 million folks. A quarter of them receive dental services. So we have about 1.3 patients a year. About a quarter receive dental care. Many of them, as we mentioned earlier, you can get up to 4 levels of care all in the same visit, which is great for our singles moms bringing their kids in and need multiple services on one day. Then they meet with their community health worker, which we don't get reimbursed for, but that's a vital service of what we do every day. We are located in underserved communities, and as I mentioned, it is our job, it is our role to care for everyone in those communities, no matter your ability to pay. And for some of our older folks in here may remember the movie with Michael J. Fox, Doc Hollywood, where he was accepting a pig, trading in for providing dental care or for providing physical health care services. We're not quite doing that, but if all you can pay is $20, we are here for you. We are here for your communities. And I know my next speaker is going to talk about services for those with disabilities. We are working on how do we make sure we care for everyone in our community, no matter your ability to pay, no matter your status as a citizen, no matter what. That is our goal. That is our requirement by federal law. We deliver comprehensive cultural component care, primary care, dental care, as I mentioned. We provide services, again, regardless of ability to pay, and we focus on patient-centered integrated care. So as, again, we mentioned, we can get paid for 4 services, but we were talking to our folks at primary PHMC in Philly. By gosh, I can never remember what the PHMC stands for, but their dental practice, they partner with Penn, but they do a lot of referral to patients over to the primary care side. The primary care site also does a lot of referral back into the same day for dental care. It's about integrating all of that care and advocating, not just with the public, but with our patients about what's available and making sure that they realize how important all of that care is. Advocacy doesn't always just mean outside groups, it means internal. How do you talk to your patients about getting not just themselves cared for, but their families, their extended families, their communities, because we are really in a lot of those refugee communities or those communities that are forgotten or left and are hesitant to be part of our groups. That's where our FQHCs really do a great job of advocating in those communities and hiring their workforce from those communities. That's where the community health workers come in and others to be the resource and the voice in those communities that aren't getting the level of care they need. So why is advocacy so important? Because FQHCs, but more importantly, our patients that rely on us for care rely on federal funding. As Helen mentioned earlier, we finally got a state budget bill. We're the last state in the nation, number 50, to finally have a budget. But we're hopeful the federal budget gets, or at least the continuing resolution where we get a lot of our funding, is going to be passed, in theory, if the House passes it today, should be through funding through the end of January 30th of 2026, and then who remembers I'm just a bill, yes, I'm only the bill. We're going to go through all of that again at the end of January. We haven't had a real budget bill in about 3 years, and I think only once in the last 6 or 7. State grants are incredibly important. Foundations and private grants, patient revenue. Advocacy is important because funding is important, right? We've all heard the phrase, no money, no mission. We're all, as FQHCs, we are all nonprofits. We must be by federal law. That doesn't mean we don't need a profit to be able to provide care. We're not out here to get rich in FQHC land. We are here to provide services and make sure folks have access to high quality health care at all time. What is advocacy? It's about relationship building. It's really about making sure you're building those relationships with your patients, making sure you're building that relationships with your staff and the folks that work in your centers, and then being able to communicate that to your communities. So whether that's your elected leaders, like your legislators or members of Congress, your county commissioners are incredibly important. We all seem, when we talk about advocacy, think of our state legislators, and we think of our members of Congress. That is just a limited part of that. It's just as important to be talking to your Rotary, to your local Kiwanis, to the hospital, and to other community leaders, the mayor, the local, I don't think we have welcome wagons anymore. God, I'm old. But any of those groups to talk about what is dental care in Pennsylvania. They don't know these stories that you all have told today. I don't know these stories. I'm not out there working every day. I've heard some amazing stories that I can repeat to legislators. And while Helen really likes to talk about data, and maybe her Enter song should be Enter Sandman, because that puts usually legislators right to sleep. Talk about stories, because people can retell stories. If you've got compelling stories, and you heard Tammy talk about it and others, it's about the opportunity to tell your story. That's how that's going to relate to somebody in their community, especially with your legislators, your leaders, your Kiwanis Club. If you can talk to the Kiwanis Club and say, out of the kids at the elementary school over here, we've got 3 kids in there that haven't seen a dentist yet in their life, or whatever those stories are. You've got them. Tell them as much as you possibly can, because they don't, as Tammy mentioned, they don't know the stories. Even the representative's slides talked about how they don't know, her colleagues don't know the stories. She's not telling data to her colleagues in the House. She's talking stories, and they can repeat stories. I've had my stories repeated back to me a year later because they remember a story more than they're going to remember the statistics. Everybody's got the statistics, and everybody's issue is important. You need to put it in the reality Do some research before you go visit your members of Congress or your legislators or your local leaders. Find out who they know, what's important to them. Healthcare will be, we've come a long way. When I started in this industry 25 years ago, people didn't see dental care as healthcare. Now I've got legislators repeating back to me about how dental care is healthcare. They get it. Doesn't mean they're taking action, but they actually get it. Advocacy does work. It's just not a quick fix. Right? Telling the oral health story, I don't have to. Again, I'm preaching to the choir. But you guys know oral health is overall health, health disparities, the importance of prevention, right? The attacks right now on fluoride in water is just, right now we're living in extremely interesting times. And we'll use interesting as a good word, maybe scary times in this room for the lack of what science is telling us versus what others are telling us. I can't even read that far away. I'm guessing orange is a minute. So when you're thinking about advocacy, when you're out and about, advocacy should be part of every organization's day to day, even if you're a private practice. Advocacy for your staff should be, what are they telling, what do they go home and tell folks? What do they tell their neighbors about their jobs? Are they passionate about oral health care, and are they telling those passionate stories? Because you never know who that person is that's going to be best friends with a representative down the road, and you happen to see them at church or the grocery store, and you're complaining about being in oral health care becomes a lot less effective than saying, hey, oral health care, it's amazing. I wish we could do more, and here's why, and here's the stories. Your staff should have elevator pitches where if they get that opportunity to see their representative or see the mayor, or they see somebody that can say, here's what we really need in oral health care, here's why it's important. You all have those stories. I realize there's HIPAA. You don't have to tell the story was about Tammy. It can be about Susie, or it can be about Chuck. Make it up, but using facts. But to be able to tell your story, it's incredibly important. Make sure everything is relationable rather than transactional. And with that, be passionate. I know you're all here. If you weren't passionate about oral health care, you wouldn't be here in the first place. When you tell your stories, be passionate. Our health centers are changing the world every day. All of you are changing the world every day. It doesn't matter if it's a simple cleaning. As we heard earlier, that is a huge change and can be a huge change in somebody's life. Getting them to floss, any of those things that we're doing every day, it's a huge, it feels like it's monotonous sometimes. As somebody mentioned, when we're just throwing, our poor hygienists have to do the same thing over and over. It's making a huge difference in people's lives every day. You make a difference for your patients, for your communities. Your work is incredibly important. Don't forget to let everybody know how incredibly important it is. Just know that you're important and make sure everybody knows why oral health care is important. Thank you.